In this lecture, I am going to take you through 5 treatment principles and drugs acting through these treatment principles in the management of heart failure. Chronic heart failure is characterized by increased activation of compensatory mechanisms, namely the sympathetic nervous system and the renin-angiotensin-aldosterone system. In short term, these mechanisms are compensating. However, in long term, these compensatory mechanisms produce detrimental changes in the kidney, myocardium, and peripheral vasculature. Excessive action of norepinephrine, angiotensin II, and aldosterone increases the cardiac workload and produce cardiac remodeling. Increased cardiac workload is a common finding in heart failure and is determined by increased afterload, increased preload, increased contractility, and increased heart rate. Therefore, the therapeutic goal in the management of heart failure is to reduce cardiac workload, one, and secondly, to reduce cardiac remodeling and fibrotic changes in various organs such as myocardium, kidney, and other organs. The first treatment principle is neurohormonal modulation. The drugs included in this category modulate the renin-angiotensin-aldosterone system and sympathetic nervous system. The first class is ACE inhibitors or angiotensin converting enzyme inhibitors, and the drugs are captopril, enalapril, lisinopril, ramipril, and quinapril. The second class is angiotensin receptor blockers that block the angiotensin receptors and prevent the action of angiotensin II, and the drugs are losartan, telmisartan, valsartan, and candesartan. The third class of drug is angiotensin receptor neprilysin inhibitors, and the combination of drug is sacubitril and valsartan. The third class of drug is aldosterone receptor antagonists, and the drugs are spironolactone and eplerenone. The next class of drug is beta blockers, and the drugs are metoprolol, bisoprolol, and carvedilol. The second treatment principle is preload reduction. Preload is determined by end diastolic volume, end diastolic pressure, left ventricular volume overload. So the drugs that regulate blood volume and maintain urine osmolarity are diuretics. Diuretics are of two types, loop diuretics and thiazide diuretics. In loop diuretics, we have furosemide, bumetanide, and torsemide. Thiazide diuretics include hydrochlorothiazide and metolazone. The next class of drug is mineralocorticoid receptor antagonists, and the drugs are spironolactone and eplerenone. The next class of drug is vasopressin receptor antagonists, and the drugs are conivaptan and tolvaptan. Next, the third treatment principle is afterload reduction. Afterload is affected by systemic vascular resistance. By reducing the systemic vascular resistance, the afterload decreases. The various classes of drugs that are included in this category are ACE inhibitors and angiotensin receptor blockers. Secondly, vasodilators that include venodilators and arterial dilators that produce direct action on blood vessels. The drugs are nitroglycerin, isosorbide dinitrate, sodium nitroprusside, and hydralazine. The next class is vasopressin receptor antagonists, which includes drugs such as conivaptan and tolvaptan. So moving on to the treatment principle number 4, which is increasing cardiac contractility, and this includes drugs that have positive inotropic effect. So these drugs, by increasing the contractility, increases the cardiac output and helps to maintain perfusion to various organs. The various classes of drugs are catecholamines that include epinephrine, norepinephrine, dopamine, and dobutamine. The next class is phosphodiesterase inhibitors, and the drugs are enambrinone, milrinone, and levosimendan. These drugs, by inhibiting the phosphodiesterase enzyme, increase the cyclic AMP concentration and thus increasing the cardiac contractility. The next class of drug is cardiac glycoside, and this includes digoxin, which has powerful positive inotropic action, increases the cardiac contractility and increases the cardiac output. Moving on to the fifth treatment principle, which is lowering the heart rate. By lowering the heart rate, the myocardial oxygen demand decreases, the energy expenditure decreases, and myocardial performance increases. The drugs are beta blockers such as metoprolol, bisoprolol, And ivabradine is a drug that lowers the heart rate by acting on the sinus node. So by decreasing the sinus node activity, it lowers the heart rate and improves the cardiac performance, decreases the cardiac workload on the heart, and is helpful in the management of heart failure.